I'm Lily Lamb and I'm a Northumberland GP, and this video is aimed at people who've suffered from COVID-19 and aims to discuss some of the symptoms that you may be experiencing after the initial illness. Whilst many people recover quickly from COVID-19, we are seeing that around 1 in 10 patients who are suffering from persistent symptoms extending past 3 weeks from the initial presentation. Some people have relatively minor symptoms with the initial infection, but then find that they continue to feel unwell with a range of symptoms for weeks or even months. If you have had a severe form of illness, and particularly if you've required a stay in hospital and intensive care, it is likely that your symptoms will be more prolonged. Symptoms people experience vary from cough, fatigue, breathlessness, chest pain, headaches, memory problems, muscle pain and weakness, to rashes and low mood. If you are concerned by your symptoms or if they appear to be deteriorating, please make contact with your GP. All GPs are offering telephone consultations at present, but if they feel that you need to be seen, they'll be able to arrange a face-to-face appointment for you at the health centre. It's very important that you seek help if you have worsening breathlessness, new chest pain, confusion, or if you develop new weakness of a limb or of your face. You may need some medical intervention with your ongoing symptoms, and these could involve further tests, treating secondary bacterial infection with antibiotics, and getting any long-term conditions such as diabetes under better control. Some people, particularly those who've been admitted to hospital, will be followed up in specialist clinics with chest x-rays and heart scans. However, many people will not require any further follow-up or tests. You can help to manage your own health by taking paracetamol for muscle aches, by obtaining a machine to monitor your oxygen levels, and these are available through many online retailers, and checking your oxygen levels on a daily basis during your recovery period can help to detect a deterioration in your symptoms. Levels which are persistently 95% or below should be discussed with a healthcare professional. It's really essential that if you have a long-term condition that you continue to take all your medication as prescribed and that you achieve as good control of that condition as possible. Improving your general health through measures such as stopping smoking, ensuring that you get enough sleep, eating a balanced diet, limiting your alcohol and caffeine can all really help. And it's important to make sure that you rest if you have persistent symptoms and that you pace any exercise and make sure you increase it very gradually and only if your symptoms allow. Set yourself achievable goals and be open with your relatives, family and employer about how you're feeling. Some people experience low mood, anxiety and sleeping difficulties after COVID-19, and particularly those who've been very unwell and needed intensive care admission. There are online resources available to help you with your mental health, such as Mind and the Mental Health Foundation websites, and if you're concerned, remember your GP is there to help. Being connected is important in your recovery, and being isolated can contribute to poor mental and physical health. Technology can allow you to keep in touch with friends and relatives, as well as to access information to support your health and well-being. If you do not have access to a device, or if you struggle to use the internet, please do ask family and friends if they have a spare device that you could borrow, and ask for their help with navigating the huge amount of information available. The NHS website is an excellent source of information, and there's also a website called Your COVID Recovery, which provides some really helpful information and resources to support you post-COVID. It's important to remember that each person will have a different experience with COVID, but that most people will make a full recovery without medical intervention, but this could take weeks or even months. It's really important to give yourself time to recover, to access the support available to you, and if you're struggling with your normal activities, to pace, plan and prioritise those activities, and to remember your GP is there for you if you're worried. Thank you.